Welcome to our channel, Anything Medicine. So today we are starting POXVIRUS, and we already did the general scheme of DNA viruses. So POXVIRUS is comprised of three viruses, which is Molluscum contagiosum, Molluscum contagiosum, and cowpox virus, and smallpox virus also. So these three viruses comprise Poxviridae, Pox family. Molluscum contagiosum virus is actually a virus which is important in dermatology, and it causes a raised lesion with a dumbbell center or umbilicated center, and it's actually spread by infection or contact. It's highly infectious. So this is Molluscum contagiosum, which causes raised benign lesion. And cowpox virus is a virus which is used for gene delivery vehicle. This method is important in for congenital inherited diseases. We can use POXVIRUS, injecting this virus, the gene which is lack in the patient, and we inject that virus in the patient, and we know that this virus will incorporate into DNA of patient. So we may treat that patient which is lack of genes. So, and third virus is a smallpox virus, and the best way to study this virus is to compare this virus with varicella zoster virus, which is a member of Herpes family. Herpes family. So, because we are mentioning Herpes family, let's recap the classification of herpes viruses, which comprise of three groups: group alpha, beta, gamma. Group alpha comprises of three viruses, which is herpes simplex 1 and 2, and varicella zoster or chickenpox virus, which take number 3. And group B take cytomegalovirus, which with number 5, and herpes simplex 6 and 7. And group gamma take Epstein-Barr virus, which with number 4, and Kaposi sarcoma, which is number 8. So remember these numbers, which is very important scientifically. These are very important numbers. So, and we say the best way to study smallpox virus is to compare it with chickenpox, because actually this shares some symptoms, and we need to differentiate between that. So, chickenpox and smallpox. Actually, chickenpox also have another name, which is varicella. We already said, yes? Varicella. And smallpox have another name, which is variola. First difference, we already see that by shape they differ, yes? Shape of chickenpox virus is icosahedral, while shape of smallpox virus is brick shape, and the shape of DNA even is dumbbell here, while the shape of DNA here in chickenpox virus is double-stranded DNA and linear. And the other difference that is smallpox, we already said in first video that is the biggest virus among all viruses of DNA, even all viruses. And the smallpox take middle size. So these are differences that we already said, and now we are moving to the differences, new differences. So first difference that the inclusion bodies that we're gonna see in chickenpox infection called Cowdrey's bodies, while the inclusion bodies here in smallpox we call it Guarnieri's bodies. Guarnieri's sorry, Warmieris bodies. The other difference that we say that all herpes family, sorry, I removed. We say that all herpes family take own envelope from nuclear membrane while they are living out of cells, while smallpox or other rest of DNA viruses take their own envelope from the cellular membrane. So this is first different. Like the envelope from nucleus here, yes, while here from cellular membrane, from cellular membrane. Okay, and if you compare the shape of lesion, both of them will characterized by skin lesions, but here in chickenpox the skin lesion will be centrally mainly. So we call it centripetal. Start from abdomen and neck and go to skull. So we call it centripetal lesion. While here the lesions mainly will be on periphery, on extremities. So we call these lesions centrifugal. And if you look at these lesions, you will see here polymorphic lesions, mean that at the same time you will find different stages of lesions like pustules, nodules, macules, crustation, erosions or ulcers. While here you will see monomorphic lesions at the same time, at the same place, and at the same time you will find same type of lesion. So here polymorphic lesion in chickenpox, yes, and here monomorphic lesions, and the lesions of chickenpox characterized by superficial location. So lesions of chickenpox characterized by superficial location. Superficial location. Like superficial lesions, we can say. Yes? While lesions here are deeply seated. So from these two informations you can conclude another two informations, that here the lesions heal without scar, while here the lesions here with disfigurements or with scar, yes? So it's deeply seated, yes? Deeply seated lesions. And I said already that here will be healing with disfigurement. While here no scarring. So another difference, that chickenpox is preceded by respiratory tract infection. Chickenpox is preceded by respiratory tract infection because actually the virus transported through respiratory tract, while here there is no any other manifestation preceded by. So preceded by respiratory tract infection, while here there is no any manifestation before or any symptoms before. And the incubation between respiratory tracts and the lesions that we're going to see is 2 weeks or 3 weeks, which is the incubation period. And this virus, chickenpox, actually will like after healing of the lesions, we're gonna stay in latent period in the dorsal ganglia of especially thoracic area, and it may come back as a shingle disease after stress factors. Yes. So secondary, here there is secondary form, but here there is no. Here is actually fatal. Here is not fatal and it's not so dangerous. Yes. Smallpox is fatal. It was one of the most important and fatal diseases before around 70 years, yes? And now it has been eradicated from the world. So, secondary reactivation called shingle. Shingle is gonna be on one side, unilateral mainly, but if you see an immunocompromised patient, you may find, or mostly will find, bilateral. So if you see a bilateral shingle, think about immunocompromised patient. And the difference between shingle and chickenpox, that shingle is severe painful, while chickenpox characterized by severe itching. So patients with shingle, actually they come to hospital even without dressing, without t-shirt, because even the t-shirt will be painful for them. Even the wind, the air, that's gonna be hit their thoracic area is gonna be painful. So they will come in this shape, like even they don't want their body, their upper limb to be in contact with their chest. So this is characterized by severe pain, shingle, severe pain, and actually it's due to exposure or damage or irritation to the nerve ending of dermatome that the virus is going to travel through from dorsal ganglia toward or along the dermatome. So the dermatome is going to be very painful. While in chickenpox we said it characterized by severe itching. It characterized by severe itching. Does it have complication? Yes, maybe. These superficial lesions may lead to secondary infection, and then may heal by scar if there will be secondary infection. And this is not dangerous disease, as we said, while smallpox is a dangerous and fatal. And another difference that we already said that chickenpox is the only virus that replicate inside cytoplasm because it's on RNA dependent DNA polymerase, while chickenpox is as a rest of DNA viruses replicate inside nucleus. So you're gonna see these Kudri bodies in nucleus, yes? While if you examine Guarnieri's bodies, you'll see in cytoplasm. So these are the main difference in details. Thank you.